Mm-hmm. Yes, hi, good afternoon. My name is Martine. I'm a student at St. Thomas University. Today I will be performing a head-to-toe assessment. I already have washed my hands already for 20 to 30 seconds. I've already given my patient her privacy. She have given me, verified her name and her date of birth. She was born February 19, 2002. Her height is 5'7". She weighs about 125. She weighs 125 pounds. She's 5'6", I'm sorry, and her temperature was 98.6. Her blood pressure was 124/70. And I touched all her apoptosis, I touched all her pulses, everything was good. So now I'm gonna go ahead and start with the basics by doing the head to toe assessment, okay? Okay, Jasmine. Again, I'm gonna be performing a head to toe assessment, and it's gonna require me to touch you to, feel and touch and listen to you different things that's normal versus abnormal. Are you okay with that?
Yes.
And as I touch you, if you feel any pain or you feel any discomfort, please let me know.
Okay.
Okay? We already went over your vital signs, which is your blood pressure, your height, your temperature. We've done that already before the video started. I already took your height. You already gave me permission to do that, so I'm going to go ahead and perform by touching you and stuff like that. I'm looking at my patient head. It's normal cephalic. There's no lesions, no bumps or anything like that. Hair is distributed throughout. Everything seems to be normal. Her hair matches her ethnicity. Do you feel any pain when I massage your head?
No.
Okay, wonderful. Okay, now I'm going to go ahead and, after I've touched her scalp and her cranium, I'm going to go ahead and touch her temporal artery. Now, do you feel any pain or anything like that? I want you to go ahead and open your mouth. Do you feel any pain? And close it back.
No.
Open it one more time. Close it back. Now, I'm going to go ahead and massage, touch her maxillary sinuses and frontal sinuses. I'm doing that right now. As I'm doing that, Jasmine, do you feel any pain?
No.
Okay, I'm looking at her eyes right now. Her eyes are symmetrical. Both eyes are the same color. Both eyes are looking at me. I'm going to go ahead and touch your eye. I'm going to bring your eyelids down. The conjunctiva is pink, moist. Her sclera is all white. I'm going to go ahead and ask you to look up for me. Look up. Pupil is dilated. I'm going to go ahead and do her pupil test. Okay, her pupils are is 3 and brisk. Everything seems to be going well, and the sclera is clear. Now I'm going to go ahead and test your visual fields, okay? So what it's going to do, I'm going to ask you to go ahead and cover one of your eyes, and then go ahead and let me know when you see my finger.
I see it. I see it. I see it.
Wonderful. Now go ahead and cover the next eye. Let me know when you see my finger again.
I see it. I see it. I see it.
Wonderful. Now I'm going to go ahead and perform the cardio position of gaze, which is testing your extraocular muscles, and that's cranial nerve 3, 4, and 6, okay? I'm going to go ahead and ask you to follow my finger, okay? Without moving your head, please. Okay, I do see the muscles in the eyes are strong and strength. The muscles in the eye are strong and intact. Now I'm going to go ahead and do a papillary light reflex of the iris, which basically is going to see, I'm going to go ahead and see how your eyes react to light, okay? I did that before, but I'm doing it again. Wonderful. Do you feel any discomfort, anything like that? Wonderful. Her eyes are pupil. Now I'm going to go ahead and test your accommodation. Now what I'm going to ask you to do, I'm going to ask you to look at the wall behind me. And you're going to have to go ahead and look at the pen while you're looking at the wall, okay? Do you see the pen?
Yes.
Do you see the pen?
Yes.
Do you see the pen? Do you see the pen?
Yes.
Okay, so I'm looking at your eyes. I see that you do not have any lazy eyes or anything like that. Okay? Now I'm going to go ahead and touch your ears. And I'm going to go ahead and look at certain things with your ears, okay? I'm going to look at your external ears. I'm going to look at the size. I do see that the size are equal bilaterally. They are symmetrical. They both have the same size. There's no lesions. There's no leakage. There's no drainage going on or anything like that. So, and then I'm going to go ahead and whisper something in. I'm going to ask you to cover one ear. I'm going to whisper something. I want you to let me know what I said, okay?
Okay.
Cover one ear.
I love you.
Cover that ear.
I love you.
Wonderful. I went ahead and performed the voice test in the ear, and seems that her hearing is okay. Now I'm going to go ahead and perform the Weber's test, but I do not have the equipment. I'm going to go ahead and perform the Weber's test, but I do not have the equipment. So what we're going to do with the Weber's test, we're going to go ahead and take the thong and hit it on both sides, one side to the left and one side to the right. And if she see any ringing or anything like that, it lets you know that she has problems hearing and etc. Okay? Now I'm going to go ahead and check your cranial nerve 1, which is the smell. A nose swab. Is basically you're gonna look up to your nose and I'm gonna check for bleeding and etc. Okay, look up. Now, do you smell that? Do you smell that?
Yes.
Do you smell that?
Yes.
Okay, I'm looking at my patient's nose. I do see there's no drainage. Everything is symmetrical. Her nose and her nares are symmetrical to each other and stuff like that. Now I'm gonna look at your mouth. I'm gonna be looking at your mouth and stuff like that. So open up your mouth. I do see her lips are moist. Okay, her lips are moist. The surface I'm gonna go Okay, the teeth and gums are in good condition. The hard and soft palate, there's no lesion, there's no bruises. Tonsils are not inflamed. 1 + 2 to 4 + 1 to 4. Let me see. Is at a 4 and everything seems to be intact. Now could you please stick out your tongue, please? Okay, now I want you to know, stick out your tongue. Now I want you to say ah. Cranial nerve 10 and 11 is intact. Now I want to go ahead and ask you to go ahead and move to the right and to the left and check. I'm going to go ahead and check for the lesion. So what I'm going to do, move your tongue left to right, up and down. There's no lesions or anything, so her tongues are intact. Now I'm going to go ahead and inspect your neck. What I'm going to do, I'm going to go ahead and ask you to turn your head to 45 degrees angle, which is this way where I can see your veins. And I do see that the veins appear flat. I'm going to go ahead and palpate your artery, or your carotid artery. And I went ahead and palpate the other side. I'm going to use the bell of my stethoscope to see if I hear a sound, okay? And I went ahead and auscultate her carotid, and I do not hear any bruises or anything like that. Now I'm going to go ahead and check her lymph nodes. Okay, what I'm going to be palpating, I'm going to checking her lymph node, which is the cervical, preocular, postocular, occipital, submental, submedullary, jugular, starting superficial, cervical, deep cervical, chain, lymph nodes, and I'm palpating the trachea area, and it is midline to the patient's neck. Okay, I want you to go ahead and swallow.
She'll take you home.
I want you to go ahead and swallow now, and I do see that the patient is able to swallow. I'm looking at the thyroid gland, just go. So I'm going to go ahead and ask you to swallow. I went ahead and assessed the patient thyroid gland, and everything seems to be intact. Now I'm going to go ahead and palpate your range of motion. So what I'm going to go ahead and ask you to do, Jasmine, I'm going to go ahead and ask you to move your neck side to side, up and down. Wonderful, wonderful, wonderful. Now, did you feel any discomfort or anything like that? I'm going to go ahead and press down on your shoulders, and I want you to shove your shoulders up as I'm doing so, okay? Do you feel anything?
No.
Okay, I went ahead and assessed cranial nerve number 10. Now, I'm going to go ahead and listen to your heart rate. I'm going to listen to the right sternal border, which is the second intercostal space. Second intercostal space. Left sternal border, intercostal space. Left sternal border, intercostal space, which is at the Earth point. Left sternal border 4, intercostal space, which is the tricuspid. Mid-clavicular line 5, intercostal space. So I'm going to go ahead and listen to all those things right now, which I'll name those things, okay? So the first thing I'm going to do, I'm using the right sternal border, second intercostal space, which is the aortic valve. The left sternal border, intercostal space, which is the pulmonic valve. The left sternal border 3, intercostal space, which is the Earth point. Left sternal border, intercostal space, which is the tricuspid valve, and the mid-clavicular line, fifth intercostal space, mitral valve, which is the apex of the heart. Now, I want you to go, I hear, as I am auscultating the patient heart sounds, I do hear the love dove sound, opening and closing of S1 and S2. Now I'm going to go ahead and assess the chest and lungs. I'm going to assess the breath sounds to see if I have any symmetrical expansions, tactile primitives, and I'm going to also do the spinal process. So what I'm going to do now, I'm going to go ahead and ask you to breathe from your nose and out with your mouth as I am listening to your heart. Go ahead. Okay. Okay, one more time. Wonderful. One more time. One more time. One more time. Patient has symmetrical expansions on both sides. Patients breathe in and out, and she sounds very well. I'm going to go ahead and listen to tactile primitives at this point. So I'm going to go ahead and place both hands on flat on patient, and I want you to say 99. Okay? Turn around for me, please. Turn around your body. Go ahead. I want to say 99.
99.
Go ahead.
99.
Go ahead.
99.
Go ahead.
99.
Go ahead.
99.
Now I'm going to go ahead and palpate for Spendius process, which is the curvature of the spine by palpating and percussion. And after, I'm going to go ahead and auscultate. Okay, I do see the spine is midline. Okay. Okay, there's no tactile primitives, everything is intact. Now I'm going to go ahead, Mr. Abbott, and ask you to lay down. Put your head this way, please. What I'm going to do, I'm going to go ahead and inspect. I'm going to go ahead and inspect the abdomen. I'm going to inspect first, auscultate second, and palpate all 4 quadrants. Okay? And once I'm doing that, let me know if you feel any discomfort or any pain or as I am touching any tenderness, okay? Now I'm going to start off with the first upper quadrant, which is where the liver is, the right upper quadrant, which is the liver hook. Now, do you feel any pain?
No.
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 Now I'm going to go ahead, I went ahead and inspect. I'm going to go ahead and auscultate. Okay, I do see her stomach. Her stomach is going well. Her stomach is not distended. It's flat. It's symmetrical. There's no lesions. There's nothing going on in the belly, and etc. and etc. I did listen. I did palpate, and I did auscultate. Now I'm going to go ahead and do the pulse test. You can go ahead and sit up, Jasmine. So I'm going to go ahead and palpate the temporal pulse, the head, the carotid, the neck, the brachial, the forearm, the radial, the thumb, the ulna, the finger, the femoral upper hip, popliteal pulse back of knee, posterior tibial side of ankle, and joint dorsalis pedis tendon and big toe, okay? As I am doing that, I'm just going to see if there's any throbbing, if there's any pounding, okay? Okay, I went ahead and palpate all pulses of the patient. So now I'm going to go ahead and, my patient's already sitting up. I'm going to go ahead and perform the range of motion test, which is to see your muscle strength. I'm going to go ahead and also, what I'm going to be doing, I'm going to go ahead and push against resistance, and you're going to go ahead and let me know what you feel, okay? You okay? Now I want you to go ahead and put your hands up like this. I'm going to go ahead and, perfect. Go ahead. Go ahead. Now I'm going to go ahead and assess musculoskeletal. I'm going to go ahead and ask you to walk across the room. Just stand up for me and walk from this end to this end, and that's it. Okay, go ahead.
Where's Eden?
Go ahead. Okay, now I want you to go ahead and stand. I want you to take your heel, take your toe to your heel and bring it up like that. Do that to the other side. Okay, now I want you to go ahead and walk on your heel and walk on your toe, going across, please. Okay. Okay, wonderful. So now I'm going to go ahead and have you sit down, please. Okay, now I just went ahead. I just tested your Romber's test, and I do see that you did do well. You did not have anything. You were good with your balance. Okay. Now I'm gonna go ahead and hit your knee and let me know. Put your knee straight. Cross your legs and let me know if you see anything. Do you feel that?
Yes.
Do you feel that?
Yes.
Do you feel that?
Yes.
Now, did you feel any pain or anything like that?
No.
Wonderful. So now I'm going to do a neurological test. Which the neurological test, I'm going to have a cotton swab in my hand, and I'm going to go ahead and ask you to do certain things with the cotton swab, okay? But with this one, you close your eyes, okay? So right now, I'm going to go ahead and ask you to close your eyes. Now, do you feel that? Yes. 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 Wonderful. Now, I just perform a light touch with the cotton swab. Do you feel that? Yes. Do you feel that? Yes. Do you feel that? Okay, wonderful. So I went ahead and did the cotton swab, face and hand. Now I'm going to go ahead and do the position, the sense. I'm going to take fingers. I'm going to ask you to have your fingers up and close your eyes. I'm going to put an object in your hand. Now, do you know what this object is?
Yes.
What is it?
Is it a paperclip?
Yes, it is. Wonderful. Now I'm going to draw something in your hand. Do you know what letter I am drawing?
Yes.
What is that letter?
An X.
Perfect. That is correct. Now I'm going to go ahead and do the cerebral battle function, which is the finger to nose. Now I want you to do this. Open your eyes. I want you to do that. Wonderful. With the other hand, please. Now I want you to go like this. Wonderful. You go down. Now, if everything is okay, your back is fine. Your back is fine. So now this concludes your health assessment. Thank you very much for your patience. Thank you for giving me your time. This concludes my home health assessment. After all of this, I realized that there's nothing going on with Jasmine. Everything was intact with her. Everything was normal versus abnormal, and her pulses were great. Everything was symmetrical. She did not have any lesions, no bruises or anything going on. Okay. Thank you, and I hope you enjoyed the video.